Hello, and welcome to episode 4 of the On Air Advocate podcast, where we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. My name is Tammy Flynn, and I am your host, as well as the creator of the On Air Advocate, and I am absolutely so thankful and grateful that you have taken the time out of your day or evening to hop on over and listen to this episode 4. Now, as you guys all know, at the On Air Advocate, we usually like to pick a weekly focus. And so this past week, I already had my focus of what I was going to do for my podcasts and YouTube videos and all of that. But about a week and a half ago, actually on January 2nd, to be official, my grandmother, who is 97, yes, I said 97, she'll be 98 this year, ball of energy, let me tell you, I hope that when I am that age, I can even have a fraction of what she has. She became pretty ill. Now, she has had some illness, but all due to just her age. About 6 months ago, we found out that she was in congestive heart failure. She had a short stint in the hospital, and we just found out that, obviously her heart is working at about that 40%, and it is due to old age. And there's just really not, much that can be done about it, and especially if she doesn't want any of the other aids to make things more comfortable for her. So we've just kind of gone with it. She's still living on her own. Absolutely fabulous. She is just a force to be reckoned with. So on January 2nd, I was over visiting her, saw that she wasn't feeling, awesome, but she just thought maybe she had a little bug or something going around. And so, my mom was there, my sister was there, came back on the 3rd, and she seemed like she was having a little bit more problems breathing and definitely a little bit more lethargic. And so I said, hey, we need to go. We need to go in, called her doctor, and did all of that protocol for that. So where this leads me to is that, in my wheelhouse, obviously having a child with significant special needs, also having worked in the medical field, but mostly in pediatrics, I am very well aware that there are so many things within elderly care that also mimic things that we do in the pediatric care because they both become so fragile. Whether you're a child or an elderly person, you are more at that fragile state. But spending long durations within the hospital and watching hospital protocol and continuity of care and all of that, when we're talking about somebody who is elderly and fragile, I have not experienced firsthand a ton of. And so I have lots of people within my healthcare world that I refer to when I have clients and things that come to me with questions within that elderly realm. But actually being there for full planning of care and watching that continuity of care and how they are treated in more of the hospital setting versus the nursing home or assisted living setting is something that I was not... I guess I didn't have as much clarity on. And after spending over a week in the hospital, sleeping there with her, and really bridging this and now her coming back home, I feel like it has brought me full circle. And so, when I go to the hospital with my own child or I'm advocating for another family, there's so many things that are on my checklist. And like I said, that is usually in the realm of children that have different abilities or young adults, etc. that way. And so bringing my grandma into the ER with her being quite ill and her having the congestive heart failure as another underlying condition on board, my eyes were just opened, and I said to myself, I cannot go with the theme I was going to go with. I need to think the way Martin Luther King, he thought, and obviously we're celebrating his week, that, we need to speak up. We need to use our voice, and we need to advocate. And so the Lord spoke to me. He spoke to me and said, that is what your podcast this week needs to be about. And that is about using your voice and advocating for yourself and your loved ones and just some things. So this is going to go and circle a little bit more around the elderly, but it all really pertains across the board, because what we accept is what we will be given. And so when you are in that situation in an ER, in the patient care world, you need to realize that what you're going to accept, if you are okay with those doctors not introducing themselves, if you are okay with the level of care that you are getting, even though you're not satisfied, you will continue to get that level of care. So what I am here to kind of open your eyes to, the same as mine, is just some things that I saw, and I think that it will definitely be on an elderly checkoff list that I will be creating. I have obviously ones for pediatric and young adults, but this is something that I was just so incredibly shocked by. So the first thing is, when I have found, and this is across the board, when you enter an ER and you've had underlying conditions, but you're coming in with a completely different condition, you really need to make sure whoever is advocating for you is well aware of that and really is speaking to that ER staff. Because sometimes what happens is whatever we're being rushed to the hospital for or being admitted for kind of steps over what our underlying condition is. But as we know what those underlying conditions are, sometimes affect everything from the way we receive medications, the things we can have, to, even settings on, how you're supposed to be laying on the bed if you have different issues with any of orthopedic needs and things like that. So even things as simplistic as that. So just really making sure that you are expressing to that staff when you are coming in, what are those underlying conditions, so none of those get missed. And I know we say, okay, we're at a hospital, they have our charts, they're not supposed to get missed, but what I can tell you is doctors, nurses, and aides are all human, and so things can get missed. I remember, and this is completely off topic, but it does pertain to what we're talking about. My son was rushed to the ER, and he was going in for something that had absolutely nothing to do with any pre-existing condition. And so he was taken in as a trauma patient. This will be a different podcast I'll do on a different day. So he was taken in as a trauma patient, and they completely overlooked the fact of his allergies, mixtures of medications he was on, etc., because he was coming there in this urgency, and all the doctors cared about was stopping the bleeding. And so some of those things can get missed. And so it is your job, as when you're advocating for yourself, your loved one, to speak up and let them know what medications you're on, what are your allergies to things, if there is any other pre-underlying conditions that need to be discussed. Now, the next thing that I found with going in with my grandmother at the age of 97 was really how the workers were caring for her and her physical. So as we know, with babies and stuff and little kids, we're so gentle and fragile and, want to make sure they're not scared and they're not confused and they don't have anxiety. And I was there and I'm like, where did that all go? Because when you're 97 years old, even when you're 87 years old, your surroundings, your comfort, your confusion level, and people being gentle with you, you are fragile at that time. At that age. And so I just saw such an absence of that. And so working in the pediatric world and then seeing this, I'm like, why are you handling her in that manner? I understand we need to get things on her. We need to, get all of her leads and everything going and get an IV started. But remembering how fragile the state of our elderly loved ones are. And so, obviously my voice was going to be heard on that. So, I would definitely watch when we are taking our elderly loved ones into that emergency room setting or into a hospitalization, that we are making sure that people are caring for them in that way. The next thing that was kind of flooring to me is the same way that when we have our children that are admitted and we want to be explained each and everything, and the doctors come in and the nurses and the aides, and they kneel down and they introduce themselves so the child isn't scared or confused. They understand what's going to happen next. I don't know what happens when we're talking about our elderly loved ones. I mean, if you're 97 years old, you have lived in the same house for over 55 years, you have done the same things day after day after day, and here you are in a full ER, people running around, lights on, noise you haven't heard before. Do you think that the person's not going to have some anxiety, and they're sick and they're scared and confused? And so I was just shocked at the level of introduction that we received as an adult. It's kind of like they just stuck them in the category, okay, you're an adult. You are much more than an adult. You are an elderly person who is, fragile. You are 97 years old. And so when we're looking at our elderly loved ones and we're taking them in, I would put the stop button and say, hey, are we going to introduce ourselves? Making sure that at every hospital visit, every doctor visit, you are being introduced, that they are introducing themselves, that they are explaining what they are doing, that they're explaining why they're doing the test, what their hope is out of the test, and what is going to be the next steps out of it. When they're coming to take blood, introducing themselves, letting the patient know what's going to happen next. When you're getting your blood pressure, hey, you're going to get a hug. These are fragile, elderly people who deserve the same type of dignity and respect and level of knowing that they could be scared and having anxiety and confusion the same way as if we were dealing with children. So, definitely something to watch the next time that you go into the ER or into the hospital, making sure and demanding that those doctors and those nurses and those aides, that they're introducing themselves. They're letting your elderly loved one know what is the next step. What are you going to be doing? When are you going to be poking them, etc.? Okay, so those two things to start with. So we have, or maybe I said three things. So we have, our introduction, making sure that they know those underlying conditions, making sure that the people that are taking care of them, realize that they are fragile. And if they're not being treated that way, that you bring that to someone's attention. The next thing that I found astonishing, actually, is that we don't, in adult facilities, fill out the whiteboards, completely. I don't understand. If you're in the ER, you have a white wipe off board, and I know this seems like a small thing, but for the love of the Lord, write your name down. Write your name down as the doctor, as the nurse, as the aide. Let the people who are there, the family members, know who's going to be coming in. I was just absolutely floored. And then as we go up to a regular floor, what about those goals? What about things that need to be attained while you're there? Safety measures, etc., that should be written down. I just couldn't even believe the lack of care of writing down the information in an adult facility versus a children's facility. And yes, I know there's that gray area because, obviously you have a lot of middle-aged adults. But I mean, obviously I'm talking a lot about elderly loved ones as well as children. But even in the in-between, I mean, as just people who are healthy, adults going with the condition. I mean, do your job. So that brings me to the point of talking about if you really weren't meant to do this for a living, if you are not out there for the greater good, loving humankind, realizing that these elderly folks that are coming in are someone's father, mother, brother, sister, aunt, uncle, then you really shouldn't be in the field that you're in. And I would say that for firefighters, police officers, and anyone that is in the healthcare world, you are dealing with the life and the quality of life of someone else's loved one, and you should take that at the absolute highest regard. Okay, so off my tangent right there, I'm going to hop on to my next one. So now we're in the ER, and so there was a whole process that was going, on there, which I'm not going to get fully into because I could sit and go on my soapbox for about an hour and a half on this. But then when you are getting transferred, so another thing that I want you to be well aware of when you enter into a hospital, into that ER, at some point, if you're sick enough, you are going to be transferred from the ER to either the ICU or a regular floor, okay? And so much is valued on what that conversation is between that ER nurse or that floor nurse that had them when they're doing report to the next floor. And so I would urge you to make sure that when you get up to that floor, do not leave it in the hands of that nurse that she transferred that right information over to that next nurse. Advocate, use your voice, step up, and make sure that you are telling your next nurse, the next doctor you see, exactly your needs, wants, the different things that help your elderly loved one with their, let's say, confusion, if they're feeling scared, anxiety, etc. Do not leave that in the hands, because I can tell you that I've stayed in the hospital enough times that even in the world of children, it doesn't get always transferred the way that we hope that it would. So on this little journey, my grandma did go from the ER to the ICU. And so the ICU was actually pretty on board with most of the things. I would say that out of a scale, they were hitting 90% of the things they should out of 100. But now, even though you're in the ICU, you are in the actual hospital. You are admitted. So whether it's the ICU or it is a regular floor, some things that I want to go over with you that I just want you to remember to use your voice. Again, making sure in that room that whiteboard is filled out, making sure your first connection with that nurse that comes in, that took report, is very clear, because sometimes you're going to find out that you're going to start telling her things and she's not going to know some of the things that you're telling her. You also may find out that she's a floating nurse, which is always so awesome. I'm being sarcastic. That doesn't usually work on that floor, that doesn't know where everything is, and is just there floating for 4 hours, and then you're going to get somebody else. And then that message is going to get transferred again. Think about it like telephone. When it goes from one person to the next person to the next person, think of how much breakdown happens in the game of telephone when you pass it on. So just remember that when you ever think twice about being like, oh, I told this person, make sure that you tell them again. I would also, as a family member, on that whiteboard in the room, I would fill out things that you think are very, very important for the nurses or doctors to know, or things that you might think, might get forgotten. But then the next step of that is when we're talking about our elderly loved ones, the same way as we would talk about our children, is that sometimes in that realm of when you're elderly, I don't understand why there's not the same perimeters put on the help for, let's say, doing like different treatments within the room. Let's say you have to use like a spirometer. why is it that it's left there when if you were a child and you were doing it, it's going to be scheduled, there's going to be check-off boxes, and you're going to make sure you're going to attain? Because do you think my 97-year-old grandma was going to get herself out of bed when she had the bed alarm on, wasn't allowed to walk on her own, to do it for herself? So when we talk about some of the different tools and aids and treatments and things like that we need to do while we're in the hospital, think it all the way through for yourself. Like, can my loved one do this if I leave the room? If I'm not staying overnight, who's doing it? So I always say, make sure they put it on the board. If they're supposed to walk and they're supposed to walk with assistance or get out of bed so many times a day, if you're not visiting them, if you're not staying with them to know, those doctors, nurses, they need to have the aides put a checkboard on the whiteboard so you know that the goal has been attained. How else are you going to know that she's doing it and somebody is monitoring it unless you're going and requesting to see the chart? Okay? Because by the time you come back, if you do leave your elderly loved one alone, they might have had 2 or 3 different nurses and 2 or 3 different aides. So making sure that that is clear with the time on it and that it is checked off so that you know as their advocate that the goals are being attained. So whether that is for walking, activities, breathing treatments, bathing, that they have had, their bath. The same thing with toileting. Sometimes we think that, because somebody is mobile, the next nurse coming in thinks, oh, well, they're able to do some of that on their own. Making sure that you are their voice to say, hey, this is their limitations. They need somebody walking with them. They need somebody helping wiping them. They obviously need soft wipes, not hard ones, for their fragile bottoms. Making sure that you're ordering up a cushion for their bottoms so they're not getting, sores. Making sure if you are seeing any of that, or they're starting to develop any sore and red spots for bed sores, that you either get them a different bed that can accommodate them, one of the air beds, or you can get some different cushions that, they can call up for that. The biggest thing is that I would remember, and I want to go back to, is also the doctors and the nurses and the aides explaining things to them. People just walk in a room, and this I noticed a ton. They just walk in the room with the thermometer to put it in their mouth. Okay, you're 97 years old, and here you have some man or woman coming at you, not saying, hey, I'm here to take your temperature. This is what the thermometer looks like again. You're going to open your mouth. The same way we would do for a child, we should be having those doctors and nurses do for our elderly loved ones, because they hold that same confusion sometimes. They sometimes have high anxiety and fears as well. And so I was just taken so aback by the level of care and then that transition. So we did go from the ICU to a regular floor, which then was an absolute complete hot mess. Because again, you have a floating nurse, you have an aide that's only there for a few hours, you're transferring people. So then that brings me to my last thing, and the largest thing is continuity of care. When you have elderly loved ones or you have children that are frequent flyers at the hospital, do not settle for anything less than continuity of care at all times. And what I mean by that is there should be no one that is in a facility that has to see a new person's face every single 4 hours, or 2 different new people's faces every single 4 hours, and have to read through that process of being scared, fearful, not knowing who the person is, and trying to have somebody who is going to keep their care consistent. By you having those same nurses for 12-hour shifts on the morning and the night as best as you can, you are going to get such a better continuity of care. They're going to get to know their patients to be able to be equipped and take care of them at the highest regard and level, as well as developing a relationship with the family members to really get to know, the patient at a deeper level and what the needs are, the goals are for going. I would also say, making sure that for your elderly loved ones, if they have things like glasses, hearing aids, that they they need help with, that you make sure that you articulate that and don't just assume that because they're a nurse or an aide that they're going to know how to put them in, how to take care of them, or that you're going to leave them there, for the safety of your own at-home items. Also, I would say watch those diet restrictions. Make sure now with kids, everything is so measured out and so tight. And obviously the parents or the nurses are the ones that are always ordering the food, but making sure that with the diet restrictions, so I can give you an example. My grandmother was on a regular floor and she had ordered, she didn't order, I ordered her food and they brought it and she is on a restriction and then they brought it again. So making sure that nurses are checking in enough, making sure that dietary is on it, and making sure that you are as present as you can be. Because I always say, we can put things on doctors and nurses and aides. And like I said, you shouldn't be doing this job unless really humanity and the love of individuals is first and foremost, and taking care of people in your heart. You shouldn't be doing it. But we also can't put blame and point fingers completely at that because we need to be the ones that are advocating. And I can tell you that there's no part of advocating that is easy. It is watching everything. It is rechecking to recheck. But that is how you keep your loved ones safe. So, on that note, I just want to run through this real quick because I did cover a ton of different stuff and I know I was a little bit all over the boards, but making sure when you head in to that ER or to the hospital to be admitted, that definitely you're getting great introductions from those doctors, those nurses, their aides, that remembering that what you settle for their behavior is what you are going to get. So do not settle. Have your expectation of excellence, as we all should, from our healthcare providers. Making sure that with our elderly loved ones, they are working gently, remembering that they are fragile. Also, at all points, remembering that they are older. They have been in their safe surroundings for such a long period of time, and there comes a lot of confusion, a lot of anxiety, and a lot of being scared when you are admitted to the hospital for anyone, much less if you're 97 years old. So to make sure that those people that are working with them are explaining what they're doing, letting them know the next steps, and not coming at them, being there for them. Making sure that the rooms that you are in are cleanly, that the whiteboards are completely filled out, that we have goals, that we have that quality of care there for that. Also, that our rooms are stacked with items that we need. If we're in isolation, we probably should have masks that are there, not that they should run out of them. So, with that being said, making sure that the things that you think should be there are there. Watching for your elderly loved ones, if they're having any breakdown of their skin, if they are complaining that their bottoms are sore, that you don't just take it for, okay, well, we should just transition them to a different position. No, you need to request some pillows for them, a cushion, an air mattress, something. Don't just let it get pushed off because that's how sores, become worse. When you are being transferred from the emergency room, from the ICU to different floors, please do not leave it in the hand of that nurse to give the best report in the world to your next nurse or your next aide. I can tell you, and I don't know if I said before if it was 90%, 99%, but every single time I feel like something is honestly missed. And like I also said, you may get a floating nurse that doesn't even usually belong on that floor. So make sure that you are taking it in your hands, your power for your elderly loved one or for your child, and you are making sure that that new nurse knows your expectations and where your elderly loved one or your child is at with things. In addition to that, making sure that on that whiteboard that we also have those activities, if they have breathing treatments, making sure that somebody's doing it if you are not going to be there, because it might be on their goal list, but if you're not going to be staying overnight, if you're not going to be there, who is doing that? Who are they assigning to it for that? Making sure that if your elderly loved one needs visual aids to see what's going to happen next, what's going to go on, that those are also provided for them. And keeping their dignity and the quality of their life and care at the highest regard. So with that, I will try to calm down my rant. I will get further into it in another episode with some other details. But I just thought, especially with influenza being an epidemic right now, it is like everywhere across the United States. And I can imagine not just my grandmother, who, has her congestive heart failure, but also that's what she was in the hospital for, developed influenza A. I can just imagine at this time how many other elderly folks have also developed that. And that within itself, because you are weak, you are dehydrated, you are coughing so much and taking away your energy, that is going to take away from you having the focus to be able to know some of the things you need to do next and needing some guidance, maybe even more than you normally would when you're in the hospital setting. So I just thought for this week, as Martin Luther King Jr. would have said, use your voice. Don't stay silent. Make sure that your expectations of others are of excellence, because these are your loved ones and they deserve the best care. So advocate, my friends, and I will talk to you real soon. Make sure that you visit me also on YouTube, our Facebook page, as well as our Facebook community. And as always, God bless.